This is Vincent, 14-year prostate cancer survivor and advocate to thousands. I just thought I'd share with you a very special story since I help thousands of people. This is a special one that stands out that I have to share with you. It involves treatment in Mexico for prostate cancer, LU177 treatment in Mexico. State-of-the-art LU177 radioactive treatment at early stage, how about undiagnosed stage, of a gentleman that has a PSA of 8 and in his 70s, and he decided he's going to go to Mexico and trust the medical care down there versus the medical care up here, which has its own leaps and bounds up here. But to trust a third world country, which I call a third world country, with your life and quality of it, is risky at best. This gentleman has a PSA of 8. He hasn't really tried to lower the PSA, which he could with PC Spes and PAMI and the medicines that go with it. Hasn't tried any of the standard ADT, which he actually is trying to avoid. So he decided he's not only not going to get a biopsy or pursue ultrasounds or any of that initial imaging that indicates he has prostate cancer. So he does a basic CT PET scan, okay, which is a Mexican CT PET scan, which isn't the same resolution as the ones we have here. So they're not going to be, the imagery is not going to be as accurate, let alone perceived as accurate it is here. So he's going in with just on the diagnosis of a PET scan that says he has a few lesions in there to be grade 5 or Pirates 5s. And they want to hit him with 2 types of radiation, they say. For a great cost, you can save almost 60% of the cost of the radiation here, so they say, which is still a lot of money. But the catcher is in the LU177. They say you can save $350,000. So their cost is $35,000 for their Mexican grade LU177, which they're going to use to charge this man, over 30 grand, 30, 40 grand. And they're going to use it as a cleanup. So they're going to inject their infuse, not inject, which is the same thing. They're going to infuse him with LU177, their version of it, which is basically liquid radiation, to clean up any of the cancer cells after the post-radiation, which any oncologist here in the United States would shudder and just look at you like you're, don't have a clue. Anyway, I thought I'd share this story with you. I'm trying to talk them out of it because there's a lot easier ways, like shooting to lower the PSA first, which can be done in as little as 30 days with the right protocols. If you cut off the androgen that feeds the prostate cancer, the cancer cells die off, the images regress, you end up having a better overall picture of everything. But insist on the best medical care. If you're going to go standard of care, insist on the absolute best, and that's here in the United States. And feel free to call me, pick up the phone. I'm always available. I live it. I only recommend things that I would do myself given the same circumstance, and with the thousands of guys I've helped and talked to, I have an edge because it's in the trench advice. So stay strong, all of you, and talk to you soon.